usually tell the child when they come in and I greet them is, this is probably the easiest doctor you'll ever go to, because it's the truth. It's very fun, it's engaging. It's not like the child is laying down, we're not pressing on them, there are no pokes. And so all of that positive encouragement is probably the best thing to do to prepare the child. So the first thing we do is just watch the child and their visual behavior as they're walking into the room and as they're sitting on mom or dad's lap. We may play a movie or show a singing animal at the end of the room, and I will just take a step back and just watch the child.
Are you watching?
Oh, yes, I can then introduce a pen light or a very small flashlight and just watch the child with my light, looking at how the light reflects off the cornea. And so much can be learned by just watching a child in that way. And then once the child gets a little bit more comfortable, I can approach the child and cover an eye, or do some other more extensive testing by covering both eyes, introducing lenses and prisms to assess their vision, to assess their muscle balance.
We then dilate the pupils, and when the pupils are dilated and the doctor sees the child with the retinoscope, with the lenses, the doctor will see very precisely what that child's refractive error is. And what I mean by that is the child farsighted, nearsighted? Does this child have astigmatism? And very precisely how much? Such that the doctor can write the glasses prescription, if the child needs glasses, from this measurement without the child ever having to say a word. And those glasses will be correct for that child. Parents shouldn't be concerned that I don't know how my child will perform. My child's a very anxious child. I don't think she'll say anything. That's okay. We have so many different objective measurements that we can use to determine how a child sees. But it's good for us to know if your child is very anxious, and maybe if your child has some sensory issues. We want to make sure with those kids that we let them know everything we're doing before we do it. And that is something all of our staff does. We don't move the chair up without telling the child. And with a child that's very anxious, and you can tell that by the way they are sitting in the chair, and we are very conscientious about those children in making sure they have a good visit.
When your child is going to be going in for an eye exam, you may think that you need to really expound on what's going to happen and go into great detail, but probably what's best is just to let them know that, yes, they're going to go to a special place to have their vision checked, and maybe leave it at that. Because if the more you talk and maybe impart your anxiety on the child, the more the child is going to be apprehensive in the exam. Another thing that I would say to the child is that to just do their best and to just follow directions and just see what they're asked to do, and it will not be hard. And if they do their best, then the exam is going to be successful and actually fun.